Stroke is one of the leading causes of death in the world. On average, there is one death from stroke every 3 minutes. What is a stroke? What are the signs of stroke? Let's find out more in the article below. 1. What is a stroke? Stroke is also known as cerebrovascular accident. This is a condition in which the brain is seriously damaged due to the interruption or significantly reduced cerebral blood supply, causing the brain to lack oxygen, not enough nutrition to feed the cells. Within a few minutes, if there is not enough blood supply, brain cells will begin to die. Therefore, people who have had a stroke need immediate emergency treatment. The longer it lasts, the more dead brain cells will greatly affect the body's mobility and thinking, even death. Most stroke survivors have poor health or sequelae, such as paralysis or weak partial body movement. AFA, emotional disorders. Impaired vision. There are two types of stroke: anemia stroke and hemorrhagic stroke. Ischemic stroke accounts for about 85% of all current stroke cases. This is a stroke caused by blood clots that clog arteries, hindering blood circulation to the brain. Hemorrhagic stroke. Hemorrhagic stroke is a condition in which the blood vessels to the brain are ruptured, causing massive blood flow, causing cerebral hemorrhage. The cause of blood vessels rupture is due to thin and weak artery walls or the appearance of cracks and leaks. In addition, patients may experience transient ischemia. This is a small stroke. The blood supply to the brain is temporarily reduced. Patients have symptoms of stroke, but only take place for a very short time, usually lasting about a few minutes. This is a warning sign that the risk of stroke can occur at any time, that patients need to pay attention to. 2. What is the cause of stroke? There are many factors that increase the risk of stroke, including irreversible factors and pathological factors. 2.1. Factors that cannot be changed. Age. Anyone is at risk of having a stroke. However, older people have a higher risk of stroke than young people. Since the age of 55, every 10 years, the risk of stroke has doubled. Gender. Men have a higher risk of stroke than women. Family history. People with family members who have had a stroke have a higher risk of having a stroke than the average person. Race. African Americans are almost twice as likely to have a stroke as whites. 2.2. Pathological factors. Stroke history. People with a history of stroke are at high risk of having the next stroke, especially within the first few months. This risk lasts for about 5 years and decreases over time. Diabetes mellitus. Problems related to diabetes are likely to increase the risk of stroke. Cardiovascular disease. People with cardiovascular diseases are more likely to have a stroke than normal people. High blood pressure. High blood pressure increases pressure on the artery wall, eventually causing the artery wall to be damaged, leading to cerebral hemorrhage. In addition, high blood pressure also creates conditions for blood clots to form, hindering blood circulation to the brain. Blood pressure examination is one of the measures to find the cause of stroke. Blood fat. High cholesterol can accumulate on the walls of arteries, forming an obstruction that causes blockage of cerebral blood vessels. Overweight. Obesity. People who are overweight and obese can lead to many diseases, such as high blood pressure, blood fat, cardiovascular. Increase the risk of stroke. Smoking. Studies have shown that smokers are twice as likely to have a stroke. Smoke damages the walls of blood vessels, increasing the process of arteriosclerosis. Cigarettes also harm the lungs, make the heart work harder, causing high blood pressure. Unhealthy life. 3. Signs of stroke. Signs of stroke can appear and disappear very quickly, repeated many times, including the body is tired, suddenly feels exhausted, the face is numb or half of the face, the smile is distorted, movement is difficult or impossible to move limbs, paralysis of one side of the body. The most accurate sign of a stroke is the inability to lift both arms over the head at the same time, difficulty in pronunciation, incomprehensible words, stuck in words, abnormal speech. You can perform the test by saying simple sentences and asking the patient to repeat. If it cannot be repeated, the patient is showing signs of stroke. Dizziness, sudden loss of balance, unable to coordinate activities, decreased vision, blurred eyes, not seeing clearly, severe headache. Headache comes very quickly, can cause nausea or vomiting. People who have a stroke may have some of the above signs, depending on each person's health condition. The signs of stroke are different. In addition, patients may experience transient ischemia with symptoms identical to stroke but only occur within a few minutes. A transient ischemia is a warning sign of an imminent stroke, possibly within a few days or a month. Signs of stroke can come and go very quickly. You need to listen to your body. When you see these signs appear, you need to actively go to the doctor as soon as possible for examination. The golden time for stroke is 60 minutes, with each passing minute. The degree of damage to the nervous system becomes more serious. 4. How to prevent stroke. 4.1. Proper nutrition. The cause of stroke comes from cardiovascular diseases, diabetes mellitus, blood fat. Nutrition is an important factor that determines the formation of these diseases. Eating with proper nutrition is an effective way to prevent stroke. Eat a lot of fruits and vegetables, legumes, grains. Eat more white meat, seafood, eggs to supplement protein for the body. Limit eating red meats. Limit high-fat foods. Fried foods, fast food, limit sweets. Foods containing a lot of sugar. Drink a lot of filtered water. Fruit juice, soy milk. For point 2, exercise every day. Exercise helps increase blood circulation in the body, improve health, and keep the heart healthy. Exercising 30 minutes a day, at least 4 times a week, will reduce the risk of cardiovascular disease, leading to stroke. For point 3, keep your body warm. Cold infection can cause high blood pressure. Increased pressure causing blood vessels to burst. It is necessary to keep the body warm and healthy, especially for the elderly during the change of seasons. For point 4, do not smoke. Smoking is one of the risks that increases the likelihood of stroke. Cigarettes are also harmful to the health of yourself and those around you. If you quit smoking within 2 to 5 years, the risk of stroke will be equal to that of people who have never smoked. 4.5. Periodic health checkup. Early periodic health checkups to detect stroke triggers and proactive intervention will help prevent stroke effectively. People with diabetes, cardiovascular diseases, and blood fat need to go for periodic medical examinations to control their condition, not to let the indicators exceed the dangerous level of causing stroke. Periodic health checkups are one of the ways to recognize and prevent diseases early, especially for patients with a history of stroke, thereby having a treatment plan to achieve optimal results.